Governor, thank you for being with us.
Happy to be here. Happy Thanksgiving.
Yes, happy Thanksgiving to you. Unfortunately, with Thanksgiving week, I don't want to start with bad news, but we got more bad news today in terms of the hospitalizations. They jumped to more than 320, the highest we've seen since early May. Is it your understanding that as early as next week, we could see patients being admitted to one or both field hospitals?
Yes, it's possible. We are readying both hospitals, and both will be ready for next week. Whether we need them or whether the hospitals decide to go live is the hospital's decision. But yes, absolutely. We had the most hospitalizations, I think, ever yesterday, 50 plus new hospitalizations. The rate of increase of hospitalizations is the fastest we've ever seen, faster than at any point in the spring. So yes, that's a definite possibility.
With all of the restrictions that you've been putting in place over the past weeks, is it frustrating, angering, alarming, all of the above to see the case numbers and hospitalizations continue on this upward trend?
Yeah. Let me say, it isn't surprising because people had a lot of Halloween parties. We saw that in the data. Lots of at-home Halloween parties, continuing to have birthday parties, hanging out with the friends around Halloween and such. So we knew that would translate into what we're living with now. Is it frustrating and disappointing? And yeah, absolutely. Last week I had to make a really tough decision, which is going to put a lot of people out of work. Bars are closing for 2 weeks. Gyms are closing for 2 weeks. It breaks my heart to have to do that. But if folks are not going to, stay at home, wear their masks, cut down on their parties, then unfortunately it's where we have to go. So I'm hopeful for the pause. I really hope Rhode Islanders take it seriously. I'm hopeful people are going to follow the rules for Thanksgiving. It's just getting real now. We're going to be pretty soon at a point where we're all going to know somebody in the hospital, and then it's going to get real for people.
In terms of the 2-week pause, which begins on Monday, 2 state representatives are calling into question your decision to close gyms. I think some people say, listen, I go to a restaurant, I take my mask off, I can keep my mask on while I'm inside at the gym. Can you walk us through again why that decision has been made and if you are reconsidering it?
Yeah, I am not reconsidering it. It's a tough decision, and tomorrow at the press conference I will be rolling out economic aid for the businesses like gyms that are going to be affected in the pause, because I know it's really difficult. Let me first begin by saying there's no easy answer and no perfect answer. And we are asking bars to close, and we're cutting back on restaurants. With respect to gyms, it's not just in Rhode Island, but the CDC has collected data from around the country. When you're at the gym, you're walking around, you're not stationary. Lots of people can't keep their mask on. People are breathing heavily, exhaling, etc. So we just thought it was prudent to put them in the category for the 2-week pause. It's all indoors. These are the things we want to try to avoid. Indoors, people gathering, moving, breathing heavily.
On the topic of small businesses and assistance for them, there's a rally scheduled for tomorrow morning calling on you to release an additional $150 million from the CARES Act money in the form of grants. Is that something you're going to do, or will the program you're announcing tomorrow look a little bit different?
It'll be substantial. We're still doing the work to figure out exactly how and how much, but it's going to be very large, and we're going to get it out the door as quickly as we can because, as I said, businesses are struggling. I will say I know some people have been critical that I've held back some of the CARES Act. I'm so happy I did, because now we're racking up the bills. Field hospitals are very expensive. Getting ready for the vaccine, very expensive. Putting money out the door starting tomorrow to businesses. So it was a good move, I think, to hold back some so that, it's there because we need it. Thank God we still have it. I've talked to some of my fellow governors, they don't have any left, and I'm so grateful we still have some money left.
You mentioned the vaccine. I know this is all still being worked out, but I was hoping you could shed a little bit of light for people. We've gotten some really good news in the past couple of weeks about vaccines, and I think people would like to know when they are available, and if someone falls into the groups that are eligible, how will they find out when they can get the vaccine? Will there be certain places that they go? Will they get a phone call? How will they know?
Yeah, great question. So good news, like really good news, 2 highly effective vaccines. Hope and help is on the way. It's important to say this. There'll be very few vaccines this year. So we are hoping we'll have some vaccines by the end of the year. It'll be very limited supply and go to healthcare workers. So if you work in a hospital or you're a healthcare worker in a nursing home, we will let you know, and we will find you at your place of work, and we will try to vaccinate you. The broad scale vaccination, where the average Rhode Islander could hope to get vaccinated, isn't going to happen until like early spring. And we are right now trying to answer your questions. We are trying, the mantra is as easy as possible. And that means there's going to be a lot of different outlets. Maybe you could go to a grocery store, maybe you could go to a pharmacy, maybe you could get it at your place of work. So we're working through all those details right now in concert with the federal government. For this year, it's still going to be very limited and focused on hospital workers, nursing home workers, healthcare workers.
In terms of the 2-week pause, Dr. Ashish Jha told my colleague Steph Machado earlier this week that this 2-week time period is probably the bare minimum necessary in order to get enough data to know if it's effective. So I know you talked through this a little bit at your press briefing last week, but how likely is it that you'll extend it past these 2 weeks? And when are you going to make that decision, after 1 week or at the end of that 2-week time frame?
At the end of the 2-week time frame. He's right. He's right. It is the bare minimum, but I've got a lot of people who need to work. So from a pure public health perspective, I respect that opinion. Having said that, we got a lot of Rhode Islanders who need to get back to work. So it's a balance. That's my constant balance. It has been shown that Google mobility data and other forms of mobility data is actually a pretty good predictor of future spikes. So we're going to be tracking that, and if at the end of a couple of weeks we see a precipitous decline in mobility, then I'll have some confidence to turn up the dial. By the way, it's not a light switch. We're not going to say everybody go out to eat. It'll be turning up the dial. If at the end of the 2 weeks we're not really seeing a change in mobility, yes, we will extend it or maybe even do more.
Governor, I know you're tight on time. Anything else you'd like to add or let people know today?
Simply to say thank you to the people of Rhode Island. It's a really hard time. Thanks for hanging in there. And to those of you who are struggling, I know it's very hard, and this is going to get better as soon as we can make it better. And happy Thanksgiving to everybody.
Governor, thank you, and happy Thanksgiving.
Thanks.